We'll talk about two important aspects of trying to get some information about your patient. So the first one is genital inspection. You're trying to look at the reproductive area of the person. So we'll be talking about why you actually need to do this. The next one is rectoabdominal examination. Rectoabdominal examination is like I'm trying to inspect the rectum of someone that's inside the anus. Then I'm also trying to do a stomach examination, okay, literally. Okay, so for these two issues, you can see. So I brought pictures of females here because on this channel we focus more on female issues, right? So they're actually very important if you want to do a thorough pelvic examination, okay? Particularly when you're talking about women. We are talking about what maybe if the person has issues with the urinary system. Do you understand? So genital inspection is the outside. So I'm trying to look at the person's external genitalia to pick up if I can see any issues. Okay, so you want to access the vulva and the surrounding areas to see if there's any issues, right? So purpose is to dictate if there's any abnormalities in the development, if there's visible infections, inflammations, discharge, or skin conditions. Okay. Also access for signs of hormonal changes or sexual development. Okay. So steps is you position the patient in lithotomy. So the person will lie at the back, the legs will be raised. Okay. Inspect for mons pubis, head distribution to see if it is female type. Okay. Lesions. You inspect the labia majora, labia minora, all of that. Look at the clitoris size and position. Look at the urethral meatus. You look at the opening of the vagina. You look at the perineum and the anus. Look at the skin integrity to see if there's traumas or any disease. Then rectoabdominal examination is you're trying to access deeper pelvic structures, especially when vaginal access is limited. Okay? So you want to evaluate uterus, adnexa, okay, and all of that, okay. Dictate masses, tenderness, if there's any abnormal structure, okay. So patient position is still lithotomy. So one hand is inserted into the anus and the other hand on the abdomen, okay. So they call that a bimanual, examination. So examiner assess for what? Uterus size and position, adnexal masses or tenderness, rectal vaginal wall integrity, and the pelvic floor to see if it is still strong or weak.